in order to engage patients as partners in healthcare improvement, I hate to say it, but the answer appears to be appallingly simple. Ask them. I had the opportunity to talk to the different patients, of whom I am one, working with the 10 improvement teams that we have at the primary care clinics at Cambridge Health Alliance. And I asked them all, why are you doing this? Every single person said, because my doctor asked me to. The second half is you have to say, you have to demonstrate that it's important to you that we're there. Not that we're not just a checkbox that you need to, just get ticked and tied and set it, but that you say, how can I help make that possible? Or what do you need? Usually it's very simple. Maybe I need a voucher for transportation, or maybe I work full time, and so if your meeting was half an hour earlier, this would be easier. One mother needed it to be okay to bring her toddler to the team meetings, and she does, and it works fine. He drops his sippy cup, somebody picks it up for him. It's good. But you have to start by asking. Patients, we don't know that there are silos out there necessarily until we run smack into one of them. And one of my favorite stories is about one of the patient partners at a clinic where they were working really hard on figuring out how to better integrate behavioral health or mental health with primary care. And she was sitting in this conversation. They were trying to figure out how much of the notes should get shared and still protect the patient's privacy. And at one point, she looks up and she says, wait a minute. If my psychiatrist prescribes a medication for me, are you telling me that my primary care physician doesn't know that? And he said, no. She said, hold on. The nexus of my trust in the mental health in the psychiatrist is coming from my primary care doctor. If you do something, I want to make sure that he knows about it. And everyone looked up and said, oh, yes, of course. I think there's something very elegantly or almost freeingly simple about having a patient saying, I need this to work. I need you guys to talk to each other, or I need this process to move more smoothly. And people look at it and say, you're right, you do. And then they work together to make it happen.